The Ottawa rules that indicate radiographs for the ankle include tenderness along the tip of the posterior edge of the distal 6 centimeters of the lateral malleolus, tenderness along the medial malleolus, the inability to bear weight for 4 steps, or tenderness in the midfoot at the base of the 5th metatarsal, or at the navicular bone. The test item cluster for patients who would respond to spinal stabilization includes patients younger than 40 years old, an average straight leg raise of greater than 91 degrees, the presence of aberrant motion, and a positive prone instability test. So will you bend over on the front of the table, please? Your stomach on the table. And I would palpate for pain. Any pain with that? Right there. Okay. Grab hold of the side of the bed and then lift your legs up off the ground. Do you still have pain?
No.
Okay. You can go ahead and relax. The test item cluster for a patient who would respond to spinal manipulation includes duration of symptoms less than 16 days, no symptoms distal to the knee, at least 1 lumbar segment with hypomobility, at least 1 hip with greater than 35 degrees of internal rotation, and an FABQ work subscale score of 19 points or less. This is the McMurray test for meniscal pathology of the knee. This is the Lockman test for ACL incompetency of the knee. This is the slump test. Could you please sit in a slumped position with your shoulders hunched over and your hands behind your back? Can you tuck your chin to your chest, please? Any pain with that? What if I apply a little pressure?
No.
Any symptoms? Okay. I'm just gonna move your leg up. Any symptoms?
Yes.
Okay. Bend your knee. Do the symptoms get better or worse?
Better.
Okay. This is the test item cluster for a patient with hip osteoarthritis. The patient self-reports squatting as an aggravating factor, active hip flexion and extension causing hip pain, a positive scour test with adduction causing lateral hip or groin pain, passive internal rotation of less than 25 degrees, this is the Faber test indicating hip joint irritability. This is the posterior drawer test. An L5-S1 radiculopathy would present with myotomal weaknesses of great toe extension or plantar flexion, sensation deficits in the lateral half of the distal leg and the foot, absent Achilles tendon reflex, weaknesses in the hamstrings, gluteals, peroneals, the gastroc and soleus, and extensor hallucis longus. It would have possible deficits in the lumbar spine active range of motion due to pain, and possible radiating pain in the posterior leg, as well as positive tests including the slump test, the straight leg raise test, and possibly the well leg test if the cause of the radiculopathy was due to a large disc herniation. And a gluteal hamstring weakness would present with no specific myotomal reflex or sensation deficits, possibly reduced active range of motion in hip extension and abduction due to weakness. All negative test findings, such as the slump test, straight leg test, and well leg test. And the patient would only present with weakness in the hamstrings, gluteal muscles, and without any other gross motor weaknesses.